Welcome to today's webinar hosted by eLotus and sponsored by Evergreen Herbs. As your leading source for quality CU content with a legacy of over 2 decades, we offer educational courses to help you elevate your knowledge and expand your skill set. With over 250 speakers, 900 courses, and 3,500 hours of continuing education, we are committed to providing you with the best educational experience possible. My name is Donna Chow, and I will be your host and your moderator for today's class, and I'm thrilled to guide you through today's session. Today's webinar is Acupuncture Solutions for Scar-Induced Pain, sponsored by Evergreen Herbs and presented by Dr. Kuo Hong Liao. The class will run from 12 to 6 p.m. with 2 breaks. And before we get started, let me go ahead and highlight some important Zoom features. First, we have the chat room. It's an excellent tool to connect with your fellow colleagues, and I encourage everyone to set your chat preference to everyone so that we can make it exclusive and everything that you type is going to be public, and so that we can all see what's going, so we're not missing out on any conversation. Secondly is the Q&A box is where you can ask questions to the instructor. And lastly, for those who qualified the CU quiz, it will be available the following workday, so Nemo will be sent to you when that quiz is available. Our instructor today is Dr. Kuo Hong Liao, who is a licensed acupuncturist and clinical herbalist in California, holding degrees from Alhambra Medical University and Dongguk University of Los Angeles. His expertise expanded with body structure therapy studies under Master Liang Chuan Lin, enhancing his understanding of TCM's efficacy through logical body analysis. Dr. Liao has an impressive collection of Chinese Mandarin courses with us, so if you are interested in learning more from him, please visit his instructor page at elotus.org. Let's go ahead and welcome Dr. Liao and start the class.
Screen 3, 2, 1. Can you do a sound test?
Okay, test. Can you hear me? Can you hear me? Okay, let's start, okay? Hi, everybody. My name is Kuo Hong Liao. It's my first time speaking English, so I think no one knows me. So I just briefly introduce myself, okay? I'm an acupuncturist, licensed acupuncturist, and also a DAON. I practice in Southern California, the city of Chino and Glendora. Okay, and let me introduce myself a little bit. When I was kids, I'm like a nature boy. I like insects, I like wild stuff. I always collect the beetles, insects, frogs, lizards, or plants. We're not home to breed. I like nature stuff. So I watch all the National Geography, Discovery, everything. I like science. I like the nature science. I like to think and think about to know the cause and effect. Okay, so basically I'm the nature science boy. So I come to America when I was 24, when I was adult. And so excuse my English. English is my second language. So if anything you cannot understand or the vocabulary I choose wrong, excuse me, let me know. I'll try to change that, okay? And when I start to study Chinese medicine, and at that time I have a full-time job. So I can only take class at the nighttime and the weekend. And when I enter school, it's the 4th quarter. So all the basic class is gone, like a basic TCM, basic single herbs, all of that is gone. And I have a full-time job. I want to finish my class as fast as possible. So I just took whatever class I can take. So at that time, the class I can take is more Western medicine. So I take anatomy first, physiology, pathology. So I took all those Western medicine class first. And few semester after, then I start to take the TCM class. So when I start a TCM class, I already have some basic common sense about the science or the Western medicine. So when I start a TCM class, I always try to use some element of what I learned already to fit in a TCM class to think about it. What happened for the TCM class? The human only have one body. If this science happen in a TCM expression like 木克皮土, like a wood element overacting on the spleen element. And what's the same thing we can find out in the Western medicine, like a sympathetic nerve overacting to suppress the parasympathetic nerve. So that's how I think things and how I learn the Chinese medicine. Okay. And in about 8 years ago, I start to expose or the new method, like body structure concept. At that time, I figured out a totally new method to look at the life. It's like traditionally, physics, like Newton have the three physics laws. It can explain a lot of things, but something cannot be explained. But when Einstein came out, Einstein have a new things came out and can explain more things and cover all the Newton's physics laws. Then,
Closer the mic, please. It's a little bit low on the volume. Continue.
okay. So the body structure thing really make me rethink about all the Chinese medicine, Western medicine thing. And I figure I'll use this way, I can almost explain everything. So today I try to introduce this to you guys about this through today's seminar. We want to talk about scar, but actually the big portion we're gonna talk about the body structure thing. Okay. So that's a basic about myself. And can I know you guys a little bit by you sharing some information for me? And how many years practice you guys did? Like average, can you type in how many years you practice in the chat room? Let me know. Whoa, okay, that's a lot. 20. Oh, wow. Some of you is more experienced. Wow. Okay. Okay.
50.
Okay. Wow, that's cool.
Over
Oh,
20.
I think most people are longer than me. And for me, it's about 12 years. Okay.
5.
Okay. And any of you guys doing the hand method, like Tuina, chiropractic adjustment, or fascia release technique, or any other PT, the method? Any of you? Oh, Tuina.
Yes.
Oh, got it. Tuina. Fascia, maybe. Okay. Oh, fascia method. Oh, that's cool. So maybe for that one, easier to understand what I'm talking about. Chiropractor. Okay. Cupping. Okay. Cool. Okay. So when you do acupuncture, are you guys, before you do acupuncture or when you try to find points, are you guys trying to touch in the patient to feel what's wrong with the body or to feel where's the point? So everybody does so, or you just based on a school teaching, based on a symptom to choose the point? Oh, patient, okay,
Yes.
okay. Okay, great. Okay, we're gonna talk about a lot about that, or why we, or how we to find a issue area today, okay? Okay, and one more question I'm always curious about. When you practice, what's a priority? Let me give you 3 choices, okay? First thing is your practice is about to make money. It's not the first priority. Or to learn the method or figure out how to reduce the symptom faster. That's a second, A and B, okay? And third one is try to really heal the illness from the bottom of the root, or to understand what's the real cause of the disease. That's a C. Okay, think about these 3 priority. What's your priority? How do you rate that?
Can you
Oh,
repeat
everybody see? Oh, okay.
Can you repeat ABC one more time, please?
Okay, A is your practice is about to make money. That's the first priority. Okay, for sure, the 3 priorities is always there, but just everybody has different sequence. And second is try to find a quick way to relieve patient's issue. But relief sometimes doesn't mean heal. Okay, sometimes relief is we kind of disturbing the balance to make it compensate faster. Okay, but that's a efficiency. A lot of people want to learn the method actually is based on this. And C is the hardest one. C is try to find the root of the issue and try to solve the issue from the root. It might not be direct treatment. Sometimes like maybe we use a distal point and patient might be confused. How come my pain is on the neck? How come you need the arm? Okay. So most people see, wow, that's so cool. Okay. I think if a lot of people like this, BC, okay? B, okay?
BC.
Yeah, because B, you have to impress the patient. A lot of times it's important. Yeah, okay.
That's good.
Okay, that's good.
BA.
Okay. Okay. Yeah, I think most people B first because they have to impress the patient first. But C is the achievement of your practice. Okay.
Nobody want money?
Usually money come with your skill. If
No.
you can build a really good reputation, the money come with a skill. Okay. Okay. And let's continue, okay? Okay, that's today's outline. The topic of today is about the scar tissue, but actually you can see my outline. Only the first one is talk about scar tissue, and 2, 3, 4 is totally something else. And 5 will back to scar tissue again, okay? Have you guys wondering how I do this way? Like it's my first class in English. Oh, you want a microphone?
Yeah, because you like to play back.
Okay.
It's
No,
better.
she told me how to sit perfectly, so I cannot lean like that. I rather go forward. Okay. Okay. Okay, let's continue. Yeah. So like I say, it's my first class in English. And I think the thing I'm gonna talk about might be very new for most of you. So I choose a scar as a topic is I want to use the more extreme condition of your body to easier to describe the body structure concept. Okay, so it's like Newton, like an apple fall down. You can tell, oh, the apple leave the tree so it falls down. But the mechanism is complicated. That's why Newton involved the 3 physics laws. So today, the 2, 3, 4 is all like I try to describe why. A lot of time you don't need to know the result. You need to know why. So the result means things. Okay? It's like physics. I told you that like Einstein invented that after you know the mechanism, you can just do like a nuclear bump, or you can just do the observation of the see how the universe works. You can do different way, but you need to know the mechanism. So today, we talk about scar, but actually we use this more extreme condition of your life or your body mechanism to become a vivid example to talk about the body structure. Okay, let's start. Okay. Can anybody read Mandarin? 牵一发而动全身. That's a traditional Chinese term. That's a slogan of today. That's throughout everything. You guys have to have this concept. This means you pull one hair and whole body is affected. Okay, for easier to understand, like if I point you guys, am I only using my finger muscle to point you? Only my finger muscle move? No, my arm muscle has to support my wrist and my finger to point you, right? So it's not only my finger move. Besides my arm muscle, my rotator cuff, the deltoid, bicep, everything have to move, right? And the physics leverage change. So my body lift, the leverage increase. So I have to balance my body. So my neck muscle has to hold that too. My other side of the waist have to hold that. And they're gonna pull my pubic. So my sitting bones angle might change, my foot angle might change. So when I only do one single movement, actually my whole body has to move to make this movement happen. As a life, as a self-sustained unit, the thing internal has to be balanced. So when one movement happen or one thing change, the whole body have to follow this change to do some adjustment. Okay, that's throughout everything. Life is like this. Life is not a not moving thing. The balance is constantly do adjustment as a life. We constantly against the outside. We constantly react to the outside. When we want to do something, we constantly try to react to this movement to achieve the internal balance. That's a 牵一发而动全身. That's throughout everything. Okay, that's like a Kung Fu 心法. Like 心法 means the key word, the how it works, how the science behind that. Like you play Tai Chi or something, it's not like 24 movements, like not the 24 movements. The key important is not how to do the movement. The key is to know how to feel the force line connection. The force line is equal from the foot to the body to the movement. Everything is in equal tension. It's not just do the movement, or not gonna be exercise only. So for Kung Fu 心法, the 牵一发而动全身, pull one hair and whole body is effective. That's throughout everything. That's a 心法. Okay, and why do we need to treat scars? Have you guys think about anything? C-section, yeah, that's a common meridian, yes. Oh, create pain, we will talk about why. Qi stagnation didn't explain too much mechanism. We can explain why it's a qi stagnation. Yeah, scar like knots, but knots can be the tension line between the scars or between other things to become knots. Yeah, but sometimes if you talk about unbreaking meridian, you're not talking about too much about the mechanism. So we'll talk more about the mechanism today, okay? Okay. So the scar is not just for pain, it's the whole structure has to base on that to do changes. So it's gonna affect a lot of things. So we're gonna talk about that today, okay? Let's continue. Okay. Do you know what scar can cause for the whole body's problem? That's everything. Basically, that's everything. Can be pain problem, any kind of pain, depends on how the scar pulls. Can be a skin problems. So if you think about the tension pull all the way to the skin, make a skin tissue stretch or compress, the circulation or the immune reaction or lymphs reaction gonna be all different. For sure, they can change your skin problems. For a body shape change, for sure, yes. Like something pulling your front and you still have to look forward, you have to make your neck up and you become a hump of that, for sure. Range of motion, yeah, of course. Digestion, it depends on how you pull. If you pull the internal layer, it creates a digestion issue. Emotional, I'll explain that later because that can be physical too. A lot of times it's not just the neural signal, it's the physics can change the internal thing. That might be very interesting, okay? Okay, and self-immune for sure. I'll explain later. I can talk more about that. Yeah, that's a lot. So basically, one severe thing changing for the life thing, the body react to that can be a lot of illness happen. It can be everything. Okay, let's talk about scar tissue. So it's more like a Wikipedia, okay? The scar is an area of a fibrous tissue that replaces normal tissue and after the injury. Scars result from the biological process of wound repair in the skin, as well as the other tissue and organ in the body. Okay, so scar is kind of like a band-aid or to heal. But like you cut the electrical wire, you cut that open, when you reattach that, you might not use the same material to heal that. You might use the electrical tips. You might use something to melt the metal together. But when you reattach that, it's not the original material, that's scar. Okay? Okay, same thing, that's more like Wikipedia stuff. The inflammation stage. In this stage, there's a redness, inflammation, swelling, loss of function, blah, blah, blah. Okay, actually inflammation is not a bad thing. A lot of time Western medicine say, oh, inflammation is a bad thing, that creates pain or something. Partially true, partially not. Inflammation is your body trying to heal something. So they want to increase the healing. So like, for example, one area has issue, your body want to bring the material to there, bring the white blood cell to there, or bring the nutrition to there, or take out the waste from there, your body might increase the traffic to there. And they create a histamine in there to make the thing become swollen, heat up. And heat up can increase the white blood cells function. So, and bring out a lot of protein material to like a fiber thing to heal the broken parts. So inflammation actually is a healing process. So a lot of time come down the inflammation too quick, you kind of shut off the body's healing process. For example, like when you're catching cold, you got a fever. Fever is a whole body inflammation. In this process, each degree of the temperature, body temperature go up, your white blood cells function can increase. I think it's a double or something. So the whole body inflammation is to help your body to deal with the issue faster. So that's why a lot of like young kids, they have a 99-degree fever or something, they give the Tylenol right away. You're gonna make their illness process become longer because their body don't have enough time to create an immune. So inflammation is the stage that your body trying to help. It try to increase the volume for the whole body, increase the efficiency for the whole body or the problem area. Okay, so inflammation happen, it's gonna be heat and swelling. They need to bring the material to there. For the wound healing, they're gonna bring a lot of fiber protein to there, like the Band-Aid to heal the wound, to stick them together first. Okay, and second, proliferation stage. That stage you start to build a scar tissue, blah, 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 same thing. Like I said, that stage is those protein fibers start to try to hold the thing together. Like we talked about, if we cut a wire, you want to reattach, you use different material to hold that tight first, like a tape, okay, like a shrink tube or something. Or, yeah. So this process, your body start to heal things together. And third stage is a maturation stage. In this stage, they try to reform. Human body have a lot of process like this. Another example is like when you broken bones, you have a bone growth cell like an osteoblast. And the other one is, let me think about, I put a name down, I cannot remember. Okay, doesn't matter. One is to grow the extra bone, the other is to deform, take out the bone. So when the bone fracture, actually they grow extra and they take out the extra thing to become the new healed bone. Okay, so the wound healing process, a lot of times like this. They grow extra things to stabilize the things first and try to smooth out the thing. It's like construction. We broke the drywall, and when we try to patch the drywall, you put a big material in there and put a drywall mud in there, so it become puffy and like looks roof, and you send that out and repaint. So body healing process is same thing. You kind of like an inflammation, bring a lot of material to there, and the fibroprotein to patch that, and they try to reform that at the maturation stage to reform that. Oh yeah, osteoclast. Okay, thank you. I learned all those in Chinese, so excuse my English. Okay, so yeah, same thing. There's just some picture to show the process. You just keep this in mind. You don't really need to know this. It's not really effect what we're gonna talk about later, okay? Okay, there's some picture under the microscopy. The left side is more like a healthy fascia, healthy tissue. And you can see the tissue is more like it looks moisture, thinner, and feels like more stretchable. It's like your closed tissue. If everything's smooth, it's like in the good condition. It's not, the fiber is not stretched, become no stretch to break. And you can look at the right side picture. It's like something that been stretched for a long time, so it deformed. It has to become thicker to hold that, and it's less stretch, so easier to break, become tight and thick as a scar tissue. And for these pictures, if you're interested, you can look at a book. That's this one. They call the architecture of a human living fascias. This book has a lot of picture about this. It's very, very interesting. I'm gonna explain you. I only have a Chinese version here, but English names here. You can type in. Oh, okay. Yeah, but this book is more advanced. It talks more mechanism about how the body fascia works. Okay, but that's very, very interesting books. Okay. And like we talked about, the scar tissue is not original tissue anymore. It's like a patch tissue. Like we talk about a wire, you repatch that like a tape or something. It's not the original tissue anymore. So it's kind of injury area when the scar tissue happens, it's like a deform. Okay. You have a different texture and quality. So depends on how you rupture the tissue. By the really poor strain, the rupture might be different. By strong twist, the texture might be different. And by really clear cut, the texture might be different. So the scar tissue can grow in all different ways. Okay. And then why scar tissue is a problem? Okay. So that's a problem. Why scar tissue is a problem is not just because it's ugly. It's because it sticks things together. It's an adhesion. That's a big issue. So adhesion is a band of a scar tissue that join two or more surfaces together. So for those surfaces, originally it should be free move because your body, different layer, they have a different function. Suppose if some layer should move to that side, contract to that side, the other should be go to the other side. So suppose in between, they have a certain degree can free move. But scar tissue is kind of when the tissue heal, it just not heal the one layer. When they heal, you kind of heal multiple things together, make a different layer stick together. It create a problem. So that's why scar create a problem to the body health. I think let me draw a picture. It's easier to understand. Let me try. Drawing. Yeah. New shape. Okay. 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 So let's draw something, okay? Like for this, it's one layer of a tissue. Let's say if that's a skin. Okay. And under that, that's an under skin, the other tissue. Let's say that's a shallow muscle, something. So those tissue, it's a muscle. So those tissue, they are not totally free move from each other. In between, there's a lot of connect tissue connecting each other. So when the skin move to a certain angle, actually those tissue gonna come like this. Okay, let me redraw again. No, that's okay. If you pull in that direction, those tissue actually gonna become like this. So pulling to one direction more. Okay, so it have some certain degree can move, but it's not totally free move. Okay, let's erase everything. And our body have a lot of different layers. A lot. Okay, each layer, they have their own direction. Like for ab muscle, the skin can have a different moving direction. The shallower muscle can go to one direction. The deeper muscle can go to another direction, like the external oblique muscle and the internal, they go in like a crossway, going to different directions. So originally different layer, they might can go to different directions with some limitation. Okay, but scar is like something cut through. It makes the tissue all here adheres together. Okay, so before it's the different layer can free move, but because they adheres everything together, it cannot move. So when one layer want to move, actually they pull the other layer. Okay, that's how scar tissue affect the body. It kind of lock everything together so they cannot free move. So when they want to move, one thing want to move, it kind of pull other things. So they create a tension pull. Okay. And let me go back. And share. Okay, I'll go back to that. Stop, okay. And what happened? You share, I cannot close. I just go back to PowerPoint.
Oh, yeah, just go ahead and select the PowerPoint, the one right next to it.
Where is it? Pause share.
Okay. Yeah, you share right here. Right here. You should
Okay.
yeah.
Okay. Resume share.
Share again, let me share. This one,
PowerPoint. Okay.
PowerPoint.
Okay. Let's go back. See the page. Oh. Let's start back again.
Yeah, really good. Click OK.
I cannot see the mouse.
Yeah, go to stop share thing. No, yeah, share screen.
Okay. Yeah. So the real problem about scar is the adhesion. It limited the different layers movement. And the limited of the different layers movement create a body issue, create a pull, create a tension. Okay. Yeah. Again, the scar tissue can lead to adhesion, which can affect everything. So if the tension become pull and push, compress on the tissues, when something get compressed, what can happen? It can become the circulation got disturbed, the lymphous circulation got disturbed, or even the neural signal. So everything might have an issue. So because it cannot free move to its own direction, it pulling each other, so it become compress or pull. Compress and pull make all the circulation or neural signal become wrong. So that's how adhesion create issues. Okay, again, adhesion. I found some good picture about that. Like a two layer, they stick together. They limited each other's movement. And like a sandwich, a lot of different layers, originally they can free move in certain degree, but scar tissue adhesion is like a pin. You kind of lock everything together. So originally, each thing can do its own job to go to different direction, but now it's get locked. Once they get locked, one want to go to right, want to go to left. In between, they get locked by one point, so become pulling each other, and you create issues. Okay. And besides the adhesion itself, the adhesion itself might be at center, but because it create a pool, like I say, different layers trying to go to a different direction. So they pulling each other create, besides the adhesion itself, it create a tension line. And tension line can go to everywhere. And two tension line locked together, that become the lock point. And lock point can be the acupuncture point we use, or can be the pen point, or can be the reflection point. So it's not just the adhesion part itself. It's the adhesion part, it create a tension line pulling to other stuff. Okay. Which one? The adhesion part? Question. Okay. For the Chinese, I'm open the chart. Oh, not 3 point. Other points. Okay. For the for example, the tension adhesion can create a different tension line go out. That's an abnormal tension line. And body always have a different tension line. And different tension lines junction a lot of times is a problem area. So the easier to have a problem area might be the tension junction, might be the traditional points. For example, like a 带脉. If your upper body and lower body go to different direction, your abdominal muscle, stable as the abdominal muscle, the front external oblique, I forgot the name of that. Front and back that may go to different direction, and the center of the diamond might push back or forward. So it's easier to feel the tight spine there. That's a tension line junction, easier to be the acupuncture point. And another example like GB34, like Yang Lingchen. When your body twists, the femur angle twist, and the tibia and fibula are doing rotation twist. So the muscle between the tibia and fibula, when they rotate, they still attach to each other, but easier to have a high tension point is those GB points, like a GB34. Okay, and those are the nature easier to happen, the force line junction points. For the adhesion, they're gonna increase certain tension lines, certain lines tension, and easy to have a junction with other, no easier to happen tension line become a lock point. And those lock point, a lot of times are traditional acupuncture points. Okay. Oh, so this part we not getting this. Oh, did you get a point? So not only the adhesion itself it's a stick everything together. The adhesion make the layer cannot free move. So like for one lock point, it's not only one thing locked here because it cannot be free move. So it create a tension line all the way to the other end. So adhesion not only create a tension at the local of a scar, because each layer cannot free move. This tension can go so very far to the other end of the body. Okay, did you get the point?
Can I cut in a little bit?
Okay, so the short summary. What?
Oh, sorry. Go ahead with your summary. Then we'll take some questions after you finish the summary.
What? Hello?
After you finish the summary, we'll take some questions because
Okay.
I don't think everyone understands what you're talking about with the tension and how that forms the acupuncture point.
Okay, got it.
Thanks.
Okay. So from the scar, we talk about scar. The really issue is it create adhesion. And adhesion is different layers stick together. They cannot free move from each other. So that become a problem. So from adhesion, we talk about the layers. So next step, we're gonna talk about layers. Okay. And a lot of people say cannot catch the point. So we're gonna take some questions right now. So can you give me your question? Let me know how to explain to you. The questions?
Okay, so Kuo Hong, can you put your earbud on? Can everybody hear me? Okay.
Yes.
I think this is a very important point here Dr. Liao is making, that first of all, originally when we designed this class, we were just talking about scars and pain related to the scars. But as I was discussing with him further about this whole idea of the structure realignment and the fascia, he said that he wanted to talk about more than just local pain related to the scar, because it's this point precisely that he's talking about, that, you know, the scar tissue will have a tension, and that tension will affect far, far away and cause a problem. Meaning, if you have like a scar on your neck, you could have foot pain that's related to that. Or the C-section, which is the focus of today's class, is going to cause you the headache because of these different layers of fascia under the skin. Originally, that could move around smoothly, but now they cannot. And I think another point that he was making that I don't understand, if you guys understand, can you type it into the chat room, is that he was saying, let me turn my camera on. So he was saying that, you know, these different layers are where the acupuncture points are. So Dr. Liao, do you mean where the acupuncture points are? Are you talking about originally without a scar, when different tensions are in the body because of the different layers of the muscles and fascia, for example? That's where you are likely to find an acupuncture point.
Yes.
Okay, so did you?
Your body have a, when you use your body, you also use a lot of different tension lines. Sorry, I cannot use a earmic as a feedback. Okay. So use our example earlier. When our femur rotate, it's not just this bone rotate. The bone under that tibia and fibula has to rotate too, right? So when the femur rotate, tibia and fibula doing the like a inner rotate or outer rotate, follow the femur rotate. Okay, so all the muscle fascia surrounding that gonna doing the like a inner rotate or outer rotate movement. Okay, so but those muscles, they are not completely moved. They have a fascia connect or connecting tissue connect. So when you're doing different degree of a rotate, the different tension point might show up in between. I'll use this as an example. Your body doing rotation movement, this area is easier to show this, and those easier to see the tension point is always acupuncture points. Or when you're doing the acupuncture, you're always looking for those points to doing needles to reverse this tension rotation.
Okay, so Dr. Liao is saying this is separate from the scar. What he's just mentioning where acupuncture points are more likely. You know how in school we study the Jingrong Su Jinghe, the 5 points, and then they describe the channels, kind of like a flow of a river, remember? And then my teacher actually said, you know, okay, when the river is flowing, the water is flowing, the most chi is going to be around where the stones are or where the crevices and the divots are. So that's where all the tensions and where the joining of the muscles and fascias are, right, Dr. Liao? That's what you mean, right?
The fascia is everywhere.
Okay.
It's just because due to the usage, those are the area easier to accumulate the fascial tension.
Okay, so where the tension is normally are where you would find acupuncture points and where you should place your needle to get the stronger chi sensation. So that's one of the points he was making. Second one, where he's talking about the layers, the tension being very, very affecting a place that is very far away, is because originally in the beginning of the lecture, remember he said when you pull a hair, the whole body moves. Is this idea of don't look at a scar just as scar localized. Is it the effect of the scar is going to affect the whole body and everything else and how they all function. Okay, that's the second important point. The third important point is what I asked Dr. Liao last week, which is a stupid question, I think. After he explained it, I realized what a stupid question that was. So Sam, can you turn on my camera? I want to show them what Dr. Liao showed me. So then, you know, everybody has an idea.
You mean you want to full screen your camera?
No, can you guys see me?
Yeah, we
Because
see
I
you.
want to show something on my camera here.
Yeah,
I
we
only
see
see Dr. Liao right now.
No, we see you.
Okay, so right now, if imagine this is the skin, right? Dr. Liao talked about this last week. I asked him, so the scar is basically there to mend the wound. So if we try to break up the scar, won't the won't the wound open up again? Is what I was asking him. And then he said that if this is the skin, okay, these are the fascia under the skin. So he said when there's a cut, the scar is not super straight, and these fascia, they don't connect to one another just like before. It's gonna be like this, intertwined like this. So he said what we're breaking is not this scar that's formed. What we're breaking are these in between, these fascia, so that they can,
Adhesion parts.
you know, the adhesion part, so that we can move smoothly. So we're really breaking the adhesion. We're not breaking the scar. So that was a very important point, because in the back of my head, I was thinking, well, the scar is there for a purpose. We don't really want to break it, right? So that is his explanation. Okay, so do you know what I mean? You know,
So,
with my
yeah,
fingers.
because later we're gonna talk about
we want
layers.
to break the adhesions, not the scar, essentially. So Dr. Liao can draw it. If you guys don't understand what it is that I just described, or if somebody can type into the chat room, I guess make it a little more clear. Okay, so if you have any other questions before he moves on to the next topic in relation to the tension and scar formation, can you type it in the chat room?
The adhesion.
I mean, not the chat room, the Q&A.
The scar tissue is a part of adhesion. So a lot of time.
But what we want is, we don't want to break this actual scar. We want to break the adhesion on the fascia so that they can move freely.
Yes.
Right? Yeah. Okay.
For that part, like example, we cut a wire. If in the big wire inside have a lot of small wire, they have their own plastic cover to prevent attach to each other. So if we cut a big wire, we just attach the outside, the inside we might attach in all the random way. Okay. What we do is we want to make it every little wire, their cover, plastic cover become separate. So every small wire can be free move. We don't want them to stick together. Okay, I saw them. So adhesion is not same as a scar, but scar tissue can be the adhesion tissue. So Sarah, did you get it? Okay, let's move on, okay? Okay, so like in here, from the adhesion we talk about adhesions lock different layers together so they cannot free move. So why layers? Because our body is formed by layers, but why? Okay, so we can talk about the embryology. So at beginning, when you just fertilize, it's like a bunch of a cell together. And they grow, expand, multiply, become like a bubble. So when the bubble happens, they still deform, they try to form something. So the bubbles start to fold. Okay, so by this picture, you can see the original like this. For example, like the plastic, a bunch of plastic, when it evolve, become like a bubble. Okay, become a bubble, they need to shape something. So they start to fold. Okay, once it start to fold, it become like a cavity, right? And become multi-layers. Okay, and they can repeat it when it keeps growing, and it can repeat it in four to create different layers. So that's how the life grows. It become like a dough. You spread that out and folding that, and spread out and folding that, like you make the Chinese green onion pancake. Okay. So that's how body become layers. So our body is formed by layers. So each layer they can slice to each other to do its own function. That's why when the scar happen, it limited the layers and become issues. Okay, here's another example of how the body form. Besides of folding, or it's still based on folding. It's a it's a little blurry, but doesn't matter. You just need to see the picture. You don't need to see the word. It's how the neural tube forms. So it's same thing. A group of a cell, they kind of change their form. It become the spatial type of cell, and folding together become like a tube. And other cell cover that, become another layer. Okay, so body is like some certain type of cell group up together, folding, become like a tube, like a cavity. Other thing covered up, become other layer. So a lot of different tube and layers folding and folding together. Your body become like a structure by the layers. So that's a concept I want to bring to you guys. And if that's all by layers, the layer got to restrict and it become problems, and that's all makes sense. Okay, so that's another picture about the cavities and layers. You can look at the right side picture. Same thing. Become like a pocket and fold, become different layers. And layers folding again and merge together, become another layer. So you can create like a cavity and like a gastro pipe, like a neural pipe, like a skin, like muscles. It's all become like this. So folding, merge, like you're making the croissant. You spray out the dough and put the oil, folding, extend, folding, extend, become like a lot of different layers. Like if we making the Chinese green onion pancake, same thing. Extend, put in the green onion, fold, extend again, and fold, extend, fold, and become layers and layers. So human body is formed by layers. By the left side, you can see different type of animal that by different folding, their body cavity is different. Okay, some might like a real cavity, some the fake cavity become like the artery or neural pipe. Some might totally don't have a body cavity, only by diffusion, by some digestion pipes. Okay, so the animals is formed by this, not just animals, the lives with cells all formed by this. Okay, have you guys know this? The hard candies, I think that's a pretty good way to explain folding and extend. So you put a certain pattern, different color inside to form a pattern, and roll, extend, and sometimes like the right side of the picture, you do different folding and roll, extend, and become patterns, like a geological patterns. Okay, so like hard candy, when you extend, every part you cut is same patterns, same layer of the folding, same layers. So same thing kind of extend to the holding from one point, become the layers, extend, so whole body is like that. So that's why for your whole body might be skin, muscle, bone, skin, muscle, bone, skin, muscle, bone, skin, muscle, bone. And with a cavity is the other thing. Cavity can extend too. So cavity not extend to the extremity, so it's in the middle. A cavity from the center part, you can see the abdominal cavity, same thing. The muscle merge together, extend. You have an abdominal cavity, chest cavity, even to the brain has a different cavity. So formed by same thing. So folding, extend. So the previous one we talked about folding and become cavity, become layers. And from one point, it keep growing to extend. And so many things, the life is like this. Same structure, same layers, and just extend. Same layer, same structure, just extend. So that for life, they always grow in the like the same pattern, keep rotating and extend, become those patterns. So same thing. That's the one I talked about. So every part of the body is like skin, fat, shallow muscle, fascias, deeper muscle, fascias, bone membranes, bone. Throughout the whole body is like that. And they are from same origin. When they extend, they are original from same thing, so tension is connected. So that's why when we do one stimulation at distal, and this layer can totally transfer to the other side. And that's why for in the school they teach you, if that's a shallow area pain, skin pain, you needle the distal, you needle shallow. If that's a deeper pain, joint pain, when you do the distal needle, you hit the bone membranes. If a digestion system have an issue, you still hit the tip to hit the bone membranes, because the bone membranes extension in the cavity is the digestion or abdominal cavities, the cavity membranes. So that totally explain. Yeah, that's use this way you can explain why the pain shallow do shallow, pain deep doing deep, and pain to the bone hit the bone. Let me finish this part, okay? So yeah, same thing. You can see that's a cutoff line of I think this one's a femur. So it totally looks like candy, right? Folding, extend, and folding, extend. So it looks like same pattern keep going up. Just totally looks like this kind of hard candy. Okay, so by this extension, like I say, different layer, they might be from same origin, just continue folding and extend. So that's why image system happen in your body. You can totally explain this. How many image system you guys know? As I remember, like a skull, like hand, like a foot, and face for sure. I didn't put on the tongue, the important one, the ear. So if you have a layer concept and you know the layer is from a shallower, deeper layer, then it's easier to help you to choose which image system to use. For example, for the tongue is direct connect to the digestion system type, right? So if your digestion system has tension, it can make a tongue's shape change. So like your stomach has issue, from the top of the tongue, you can see the concave line there. And the tongue's tissue has what kind of specialty? It has a lot of membranes, right? So it can reflect the digestion system's membrane status. Okay, so if your metabolism is high, the cell easier to fall off. You can see the tongue coating change, become thicker. Or the internal environment is more tend to acid or base. The different type of a bacteria grow, the color might change. And tongue is also full of the veins and arteries. So from the tongue, you can see if the artery is more active, the sympathetic nerve is more active, the tongue become red or even like a purple. So sympathetic nerve too exciting. So pump all the blood to the arteries. And like a sublingual vein, you can see the resistance from the vein. So from tongue, you can see a lot of internal issue because the tension connect is more to the internal system, digestion system. Okay, another example, like for the foot reflex allergy is more toward the organs. But why? Because the foot is formed by a lot of small bones, like the foot arches. And those bones angle decides your pelvic angle. And pelvic angle a lot of times decides by the organs angle or organs tension. Okay, so if your pelvic forced to tilt this way, and maybe your intestine or something have problems, so they cannot move that much. So you have to push forward. In that way, your two foot arch might collapse down. And in your foot, you can see something like a bunion area might have some extra tension because of foot arch angle change. So you have to work through certain angle for your foot. For this type of people, you might see their shoes is one part missing more because the force is unbalanced. So in other words, if your foot has injury or something, it might change the foot arch angle, and foot arch angle might change the pelvic angle, and pelvic angle change. The organ hanging in the abdominal cavity, pelvic cavity, or chest cavity, the angle might change. And those angle change might make the organ dysfunctional because the angle change become pull or push. It suppress the function or increase the function. Like sometimes you compress on the artery might feel need to bounce back harder. It might increase the function. So the reflex image system. What am I talking about? Okay, so like for foot, can more reflects to the body inside the abdominal cavity's tension. So can more talk about the organs function. And for the skull is shallow, you're holding the whole body's tension like a tent. Like you're holding the fascia, everything pushed down. So if your right side tighter, you might pull the fascia to here. And left side tighter might pull there. And if you are right-handed, you might toward the right side more. And front and back, based on the spine, how to use that. You might have a different tension. So from the head, the image system reflects the tension direction. And if the tension have a different direction, different degree, and you can use as an image system. And for the head, because it take out the more shallow tension more. So like for the arm system, the clavicle and scapula, they connect with clavicle and scapula is outside of the rib cage. So arm system is more outside, it's not like a body, not in the body trunk. So arm system easier to pull the shallow muscle tension. So for me to guess, if you use a skull needle, it might be very efficient for the arm tension, and also might be very efficiency to the spine front and back issue, like going this way. But I might not think that's not efficiency to the organ tension, because it is all more from the outside, it's not from the internal tension. And for the ear, like the ear is very interesting. Ear can be the outside tension, like a GB channel. The surrounding the ear pull down. It might go through the trapezius muscle. The tension might be from the front side to the stomach. Okay, and also ear goes very deep. It can reflect the inner tension because like an ENT system, the ear tube can go all the way inside, connect to the sinus tension or throat tension. So it also reflects the organ tension go up. So that's why ear is so special. It can reflect the outside tension and it can reflect the inside tension. You can imagine like an ear, there's a tube. So if a tube twisting, it might make an ear shape change. That's why a lot of time inners have a high twist. Front side, you can see a crease in there because they try to twist. But outside tension make it hump down. So two forces junction together, you can see the ear creased. So if you look more detail into that, you can use the specialty of that structure to see which image system easier to apply this type of issue. And I think if you can think more deeper, it can help you a lot to choose the image system to do needle to help your body.
Okay,
Okay,
Dr. Liao,
another
can you
summary, okay? So due
Dr.
to
Liao, can you hold on a
cellular
second?
different and embryology different, blah, blah, blah. Yes?
So that was all very good. Did you guys get it all? I tried to write down the summary of it all. But let me recap, okay, Dr. Liao, before you go to the summary to see if I got the imaging correctly.
Okay.
Okay. So you said the foot, treating the foot is better for outside.
Organs?
Huh?
Organs.
For organs. Okay. You guys should
Compared
write
to
this
hand.
down. These notes are very good. Treating the foot is better for internal organs. So the foot reflexology is better for organs because it's connected that way.
Or
For
the
the tongue,
foot channel. If you talk at the Yang Ming channel, the hand Yang Ming or foot Yang Ming, if you want to treat the organ, Yang Ming Fu Zheng, you maybe the foot is better than the So Yang Ming, the hand Yang Ming.
okay, so foot Yangming specifically, the foot reflexology and imaging is better for the organ. Okay.
Not just foot Yang Ming, all the channels are foot or an arm, right? Yang Ming, Tai Yang, Sao Yang, Tai Yin, Sao Yin, Jie Yin. They all have an arm and foot, right?
Yes.
So if you want me to choose the distal point for the organs, I might choose the foot channel. It's more directly to the organs.
Oh, I see what you mean. So you weren't really just talking about specific imaging of the body parts
No,
when you talk about the foot.
I just give you an idea to think about the method you use, how it works. How come you
Okay.
try this image system is not working good? But how come you use the others working? So
Okay.
when you think about the metabolism or the specialty of that part of the tissue, it can inspire you a lot how to use your method.
Okay. I think this is something that probably all of us at one point in our practice have thought about, because you learn local needling, acupoint needling, distal needling, different microsystems, and then some works better on some patients than other patients. And you don't know why, right? This may
Yeah.
be the answer. So you
That's the
can further
answer.
think about this. Okay, let me summarize a little bit what I just wrote down. And if I missed anything, if you guys can put in the chat what you heard, and also Dr. Liao can confirm. Okay, so this is all stemming from embryology. Foot channel versus the hand channel. Foot channel, treating the foot channel on the foot is better for organ problems.
Because
Next, tongue.
Okay.
Next is the tongue is a reflection of what's happening in their digestive system. With the blood vessels going there, the artery and the vein will reflect what's going on inside. And you also use the tongue too, because I have seen Dr. Liao treat patients and ask the patients to stick out the tongue. I think it's trying to create some tension in the deeper muscle layers.
Yes.
So that he may talk about a little bit later. And then the scalp is better to treat arm disorders.
Or shallower layer.
Or shallow layers. Write this down, okay, you guys? Shallow layer muscles, the scalp acupuncture.
And the brain itself.
And then brain itself. Recently, I've been studying scalp acupuncture quite a bit, and I find it to be super, super effective, super fast. And then auricular acupuncture or auricular medicine is a special one because it treats both outside muscle and the inside organs.
Because the specialty of the ear, the outside of the ear reflects to the shaoyang. The body have an issue, usually is twist, and shaoyang is the twist. We're gonna talk about this class in later this year.
How is ear related to seeing through near the ear? Okay.
Yeah, and shaoyang is always a sideway. So when your body try to do something, it's always twist. Like we talked about the femur earlier. So when the femur move, femur rotate, tibia, fibula rotate.
Okay.
So when you move the humerus, radius and ulna rotate. So every movement you want to do is due to rotate. And when your body try to compensate something, it's always is rotate.
Okay. This is a lot of different concepts to think about. So Dr. Liao, I think most of you are familiar with Dr. Tan's method. He has Dr. Tan's method, he has five systems.
Yeah, that's great.
Channels.
But the thing I talk about to help you to think about which time we choose the same side, which time we choose the other side. For example, like a lot of time we have the rib pain, we might choose other side of the sanjiao.
Why?
Why? Because a lot of time arm system pull is shallow muscle pull. So let me use another example. Like right-handed, easier to have the left side neck pain, right?
Yes.
Earlier we talked about the clavicle, scapula connect to the arm. It's outside of the rib cage. It's not your body trunk, right? So when that's a more shallow one, right? So when the arm system has a problem, it's tend to twist more. It's kind of bring the shallow fascia to one side more. Right? So if I pull your sleeve on the right side, which side become tighter? Left side. Left neck.
Okay.
Right? So if you want to choose the upper body for the neck pain, I might choose the upper arm on the other side. You just follow the tension to see how the trapezium rotate. And you can trace the tension to find the point you want to use. But if that's same side, that might be through the leg, to the pelvic, to the lower rib, to affect the rib movement, to affect the neck. That might be same side. So if you like a traditional pair, like a sanjiao 5, pair with the 竹林气, GB44 or something. Yeah, they are shaoyang pair, right? So shaoyang pair, you might choose a. Okay, that doesn't matter. I forget all the points. Okay, so for that twist, I might use the hand shaoyang opposite side because it's shallow twist. But I might choose the 足少阳 on same side because that's the bone tension push up. That's a deeper muscle. Yeah.
So
Does that
choose
give
the
you a
opposite.
concept about layer?
So choose the opposite side, hand 少阳, the
I think
same side,
we're
put
gonna
少
talk
阳.
about this in the Shaoyang channel class.
Okay, the 少阳 channel class. That's I think in September, right?
I don't remember.
We'll do a deep dive then. Okay, anybody else with any questions for this? You know, the imaging, why you would needle the tendon for tendon problem, needle the
Because-
skin for skin problem.
Yeah,
You know,
because the
it all
layer
comes back to embryology.
they folding and extend. So each layer they originally connect to each other.
This is great. My Dr. Liao is he thinks about the why. You know, one time when we were discussing this this class a couple weeks ago, he said you really had to understand the concept. Once you understand today's concept, you can apply it to everything. It will
Everything.
all make sense. It's kind of like he said that what did you say about the Indians? You know, when the Indians
When I was little, I watched animation or movie, I forgot.
a movie, right?
The Indian pick up a gun from a white guy and they don't know how to use and accidentally drop the gun to the floor and shoots. So
And the
every
bullet
time
came out.
they want to shoot the gun, they just drop the gun to the floor to make it shoot.
So what
Because
he's
they
saying,
don't
what
know
he
the
was
mechanism.
right. He says he said that in order to understand the mechanism of the gun is how you learn how to shoot the gun. You know, but he saw the gun fire by dropping to the floor, so you thought that was the way to fire the gun. So what most of us are learning are recipes for like different points to treat what problem. And I think in the beginning you need to do that because you don't understand and you haven't gotten into I guess in our medicine journey to really think about why do certain methods work, why certain methods don't work. You just follow those recipes and they'll work. But at some point, you're going to have to think about why does it work and how does it work? And this ties back to what Dr. Liao was saying in the beginning. Do you choose C, B, or A, right? So I think the concept today, I think you can go back and think about it. And then maybe if you have any new discoveries, please share with the rest of us, okay, in the future
I
classes.
think new concept need to took a long time to digest. You might need to repeating exposed to this kind of a thinking many times. Then you're gonna have some feeling.
Right. It's great. Thank you so much. Okay, let's go on to the next page. If you guys don't have any questions, let's look at Dr. Liao, let's look at the Q&A section. Can you pull up your Q&A and read the questions to us and then see if you can answer before we go on to the summary?
Okay, Myra gonna read.
Okay, so first question. If a patient has a bulging lumbar disc, L3 and L5, what point would help relieve the tension from the adhesion of the healing scar? Would you consider the same or opposite side?
You need to check that. If that's from the, for example, it's very common to see from the C-section scar, if the scar pulling, let me stand up, okay? Can you see me? Okay. So from the sideway, if there's a C-section scar here, like I said, they limited a lot of different layers, right? So they cannot free move from each other, so they pulling each other. From the front side, you can pull down, pull your neck, but you still have to facing forward, right? Or you might go up, so they might become like this shape. If not pull the back, pull forward, you can see a lot of Hispanic women like this. They're pulling forward and their lumbar spine cannot go down. So when they ask them to slouch down, they only use the upper body. The lumbar spine becomes no movement. And that's from scar. And that can pull the leg, make a knee inner rotate. So the knee become not gear to gear, cranking, become the knee arthritis. And they might do the knee surgery after. Okay. So for your question is, if you see they cannot slouch down, they have a lumbar spine pain or a hernia disc or slide disc, you first need to trace back the tension to see why they cannot slouch down. If you follow the side muscle feel, it cannot, it's tight, not soft, you cannot slide through a iliac bone. You follow the tension all the way, you feel the scar is so tight. Then you can try to lift the scar, pushing a little bit to see if they can have a little bit of the lumbar spine movement. Right? If you can hold that and they have a little bit lumbar spine movement and the pain reduce a little bit right on that moment. Sometimes it can be reduced a lot. And you can prove the patient, the tension is from the scar. And the scar might be the first thing you need to do because you kind of pulling forward, limited the spine's movement and force it has to go forward. Does that make sense?
Okay, and the next question, kind of a review. Dr. Liao, could you please explain again what the scalp acupuncture is used for?
Doesn't matter. I just use that as an example. You can think about image system. A lot of time it's on the tip of the body because the tension, you imagine use a big, the shallow muscle is like the swimming wetsuit. It covers the whole body or like a plastic gloves, right? So the tip is like a tent. One side have a higher tension, they kind of pull to different direction. That's why you can see the right-handed, the face might go a little bit this way. Left side looks better because it's tighter, and right side have more wrinkle. So the head is like this. It gets easier to pull by the shallow layer. So if you want to apply the skull needle, I want to say for the pain issue, the shallow layer effect is affected by the shallow layer. The skull needle might work better. Okay, but skull also has a special part. Skull is not, the fascia is not just cover the skull. The skull has many bones connect together, so you can see the connecting lines. Those fascia, especially bone membranes, they grow through the bone, like this. And those are movable. So that's why sometimes you can see the connection line has some fascia or like a deep tissue bulging there. That means the thing cover the bone is all shift. And that's why the bone membrane's tension shift and something bulging in there. If you stimulate this or lose that thing, you can make this thing loose up and bring the space in. And inner side connect to brain, and you can use this to change your brain function. That's why I say the skull needle, in my imagine or in my experience, it works better for the shallow layer tension issue or for the brain directly issue because we go through the bone membrane's tension, directly change to the bone membranes goes to the inner side of the skull, which connect to the brain. Okay? Okay, what's the next question?
Okay, another question more for clarification is if you break an adhesion, will it try to heal itself by forming its own scar or more adhesions?
It depends on how you broke that. Okay,
Depends.
that's why we will talk about that later. We want to use the thin needle as thin as possible. And we want to do from the shallow layer as shallow as possible. It's like peeling the onion. We don't want to chop down the onion. We want to peel in the onion. A lot of times you chop down the onion, it creates a new scar. So I really don't want to talk about other methods like a 小针刀. I think it have a quick relief, but a lot of time they chop down too much stuff. Besides the break the adhesion, it might just chop down the big stuff and create something others or make the tissue totally break. It have nowhere to go back. Since we talk about this, let me give a quick example. For example, like if the whole body's issue is due to twist, excuse me. Yes. Oh, okay. If your body has a scar tissue here, like we said, what's that? Appendix surgery, create a tension and pull everything in. Right? And this thing get pulled, so become tight in here. The whole fascia twist. Right? And when it become tight, it become hard to bend. Can you imagine that? Okay, so how to lose that? You keep rubbing there. Or 小针刀, you cut it open, make a hole. Right? You cut a hole, it become bendable, but this twist you cannot solve. But the best ways to reverse whatever happened is you lose the distal to bring the space back. So it's not a tight pins anymore. It becomes space, can free move. and you can heal. So 小针道, a lot of times you just cut a hole, has no chance to go back. So you can make it move right away, but you kind of break the structure. You got a point?
And we'll have one more question. Can the Dupuytren syndrome, which is the abnormal thickening of tissues in the palm of the hand, and trigger finger conditions, can they be treated with this method?
Yes, of course. So what is trigger finger? So you need to think about that. I think for this we better talk in the future. You just go through today's class, has a big concept of the body structure. Okay, if we talk about this, it's gonna talk too long, too deep. So just think about putting in your mind first. Let's go through everything. And I think you're gonna have some idea. Maybe you can get why this method work for everything.
Yeah, so let's talk about, let him explain all the big concepts so you guys understand the mechanism. For specific treatments in the future, we'll invite Dr. Liao back to, talk about each disease and how he treats it, okay?